Title: Stroke After 60. Here's what you must know to stay safe and healthy. Senior Health Guide. It might come as a shock, but stroke, commonly known as a brain attack, is one of the leading causes of disability and death among the elderly. In fact, over 75% of all strokes happen in people over the age of 65. What's even more alarming, many of these strokes could have been prevented. In today's video, we're diving into everything you need to know about stroke in older adults. What causes it, how to recognize the signs, how to prevent it, and what changes you can make starting today. What is a stroke? A stroke occurs when the blood flow to a part of the brain is interrupted, either due to a blocked artery, ischemic stroke, or the bursting of a blood vessel, hemorrhagic stroke. When brain cells are deprived of oxygen for even a few minutes, they begin to die. This can result in permanent brain damage, paralysis, speech difficulties, or even death. For seniors, the risk is significantly higher due to age-related changes in the heart, arteries, and brain. Why seniors are at greater risk? As we age, our blood vessels naturally become stiffer and narrower, making it harder for blood to flow freely. Conditions like high blood pressure, atrial fibrillation, diabetes, and high cholesterol, common in people over 65, further increase stroke risk. Reduced physical activity, slower metabolism, and cognitive decline also play a role. Add in smoking, poor diet, and unmanaged stress, and it becomes a recipe for disaster. Common warning signs of stroke in the elderly. Recognizing a stroke quickly can make the difference between life and death. Use the acronym FAST. F, face drooping. Is one side of the face numb or sagging? A, arm weakness. Can they lift both arms? S, speech difficulty. Are words slurred or strange? T, time to call emergency services immediately. Other signs include sudden confusion, dizziness, blurred vision, severe headache, or trouble walking. In elderly individuals, symptoms can be more subtle, such as a temporary fainting episode or slight disorientation, often mistaken for normal aging. The 4 types of stroke you should know. Ischemic stroke accounts for approximately 87% of strokes, caused by a clot blocking blood flow. Hemorrhagic stroke, caused by a ruptured blood vessel leading to bleeding in the brain. Transient ischemic attack, TIA, known as a mini-stroke. Symptoms last a few minutes to hours and go away. A red flag for a future major stroke. Cryptogenic stroke, cause unknown. Often happens in patients with undiagnosed heart conditions like atrial fibrillation. Lifestyle risk factors for stroke in the elderly. Here's where many seniors unknowingly increase their stroke risk. Poor diet, high in salt, sugar, and saturated fat. Sedentary lifestyle, lack of exercise reduces circulation and increases blood pressure. Smoking and alcohol. These damage blood vessels and elevate clot risk. Stress and depression, often overlooked but critical in heart-brain health. Ignoring medical advice, not taking medications, or going for checkups. How to prevent stroke. After 65. The 4 pillars. Nutrition. Eat more leafy greens, berries, nuts, and fatty fish. Avoid processed foods and added sugars. Keep sodium intake under 1,500 milligrams per day. Exercise. Aim for at least 150 minutes of moderate activity per week. Walking, swimming, tai chi, and yoga are excellent low-impact options. Routine medical checkups. Monitor blood pressure, cholesterol, and blood sugar. Treat atrial fibrillation if diagnosed. Get regular cognitive and balance assessments. Medication management. Take prescriptions as directed. Be cautious with over-the-counter drugs that raise blood pressure. Ask your doctor about low-dose aspirin if appropriate. Post-stroke recovery. What families need to know. Recovery can be a long and emotional journey. Early rehab is essential, whether it's physical therapy, speech therapy, or occupational therapy. Social support from family and friends significantly increases the chance of functional independence. Know that emotional challenges such as depression or frustration are common. Patience, encouragement, and setting small achievable goals are key. Hidden factors that increase stroke risk in the elderly sleep apnea. Many older adults go undiagnosed. It can raise blood pressure overnight. Dehydration leads to thicker blood and clot risk. Poor oral health. Gum disease increases inflammation, which affects blood vessels. Vision loss increases the risk of falls and head trauma, triggering hemorrhagic strokes. Best brain foods to reduce stroke risk. Blueberries, packed with antioxidants that protect brain cells. Walnuts, rich in omega-3s that improve brain circulation. Spinach, high in folate and potassium, both reduce stroke risk. Oats, helps manage cholesterol and keep arteries clear. Green tea, contains catechins that protect blood vessels. What to do if you suspect a stroke? Call emergency services immediately. Every minute counts. Note the time when symptoms first appeared. Don't give food, drink, or medication unless advised. Keep the person calm and monitor breathing. Never drive them yourself. EMS can begin life-saving treatment on the way to the hospital. Final advice and encouragement for seniors and families. If you or a loved one is over 65, now is the time to take stroke prevention seriously. Small changes in your diet, daily habits, and mindset can protect your brain and body for years to come. Stroke does not have to define your golden years. With the right knowledge and preparation, you can reduce your risk dramatically. Outro and call to action. Thank you for watching. If this video helped you understand more about stroke in the elderly, don't forget to like, subscribe, and share this with someone you care about. Let us know in the comments if you or a loved one has ever experienced a stroke and what changes you've made since then. Stay informed, stay healthy, stay strong. We'll see you in the next video.